Picture a rural village in a developing country. Suddenly, a young woman collapses in pain due to appendicitis. Her family rushes her to the nearest health post, but the nurse on duty can only offer basic care. The nearest hospital with surgical capabilities is hours away, and the chances of her surviving the night diminish with each passing moment. This scenario, though distressing, is a daily reality for millions around the world. Today, I'm going to be delving into improving surgical access in developing countries, focusing on innovation, policies, and social determinants. But first, let me introduce myself. Hi, my name is Samanyu Manjunath, and I'm a rising senior at the Early College of Guildford from Greensboro, NC. I have research intern experience with the Wake Forest School of Medicine, with diuretics and cardiovascular health, pediatric hypertension, and youth with eating disorder behaviors. Additionally, I am the NC HOSA State Vice President, the UNICEF President and founder of my school's UNICEF chapter, and a UNICEF advocate. I'm extremely passionate about global health, nutrition, cardiology, oncology, epidemiology, policy, and innovation. Additionally, I've conducted educational workshops and curriculum training in India, and many of my family members live in rural India, and their struggles with access to quality care and surgery have been a powerful motivator for me and have kind of inspired me to take on this passion and interest in global health and innovation. Additionally, I'm part of my school's Science Olympiad and Student Human Relations Coalition teams. Surgical interventions are a crucial component of global health, addressing critical needs across various conditions, from infections to fractures to burns. Surgery prevents long-term complications and disabilities, and trauma surgery is equally applicable in natural disasters and even in human conflict. Despite its importance, surgery has often been overlooked in public health discussions due to perceived high costs. However, the impact of surgical care on individual and community health underscores its true significance. According to the World Health Organization, about 5 billion people lack access to safe, timely, and affordable surgical and anesthesia care. This deficiency is most acute in low and middle income countries, where surgical conditions contribute to approximately 30% of the global burden of disease. Essential surgical procedures can avert about 1.5 million deaths annually, accounting for 6 to 7% of all preventable deaths in developing countries. Despite this, it's reported that in LMICs, up to 90% of the population cannot access basic surgical care. Additionally, the populations most at risk due to limited surgical access include children and pregnant women, trauma victims, and patients with emergency conditions. One of the promising approaches to addressing this crisis is the concept of frugal innovation. Frugal innovation refers to the development of affordable, accessible, and context-appropriate technologies that can deliver essential services without the need for high-end infrastructure. For example, in rural Northeast India, a novel approach to laparoscopic surgery called gasless laparoscopy has been developed. Traditional laparoscopic surgery requires expensive carbon dioxide gas and trained anesthesists, both of which are often unavailable in rural settings. The gasless laparoscopy technique, however, uses a simple mechanical device to create an operating space without gas and can be performed under spinal anesthesia. This innovation has been successfully implemented in rural hospitals and significantly reduced costs and improved patient outcomes. The Global Ideal Sub-Framework emphasizes the importance of context-specific evaluation of surgical technologies and adapting them to suit the unique challenges of low-resource environments. For example, instead of using randomized controlled trials, which can often be resource-intensive, adaptive trial designs and pragmatic evaluations are used in low-resource settings. In Sierra Leone, the introduction of the Elizarov frame for treating lower limb fractures further shows this approach. Traditional methods of fracture treatment, such as bed rest and skin traction, are often ineffective and lead to prolonged recovery times. The Elizarov frame, a low-cost device that uses tensioned wires and rings to stabilize and lengthen bones, has been shown to improve healing and recovery rates significantly. Other innovative solutions in surgical care include mobile surgical units, telemedicine, and local manufacturing to reduce costs. When looking at the trade-offs between resource inputs and health outcomes, through cost-effectiveness analysis, we can see that essential surgical procedures have been found to be highly cost-effective, with costs ranging from $10 to $220 per disability-adjusted life year averted. And through benefit cost analysis, we can see that investments in essential surgery often yield high benefit cost ratios, sometimes exceeding 10 to 1. In many developing countries, cultural beliefs and practices influence health-seeking behavior, perceptions of medical interventions, and adherence to treatment. For instance, in some communities, surgical interventions may be viewed with suspicion or fear, leading to delays in seeking care. Additionally, gender norms can impact access, with women in certain cultures requiring permission from male family members to seek medical treatment. To address these cultural barriers, it is essential to implement interventions that are culturally sensitive and community-driven. One successful example is the implementation of the WHO Surgical Safety Checklist, a 19-item tool designed to improve surgical safety by enhancing team communication and ensuring the completion of critical safety steps. A study conducted across 8 hospitals worldwide, including locations in Tanzania, India, and the Philippines, demonstrated that the use of this checklist and adaptation of it to different cultures reduced the rate of surgical complications from 11% to 7%, and half the rate of deaths. Social determinants of health, such as poverty, education, and access to transportation, play a huge role in accessibility and outcomes of surgical care. For example, even when surgical services are available, patients may not have the financial means to afford surgery or even get to the healthcare facility in the first place. To address these barriers, policy interventions must focus on ensuring financial protection for patients, such as subsidized healthcare and transportation vouchers. Additionally, community-based health education programs can raise awareness. In Ethiopia, community health worker programs have been especially effective by providing essential preoperative and postoperative care, educating communities about surgical conditions, and even facilitating referrals to surgical facilities. While innovative approaches to surgical care are essential, they have to be guided by ethical considerations to ensure safety. Task shifting, for example, involves training non-physician clinicians to perform basic surgical procedures. It is crucial to establish rigorous training and supervision protocols to ensure that non-physician clinicians can effectively perform surgeries. Ethical considerations also extend to the equitable distribution of surgical innovations. Innovation should not exacerbate existing inequalities, but rather aim to reduce disparities in healthcare access and outcomes. To continue to improve surgical access and outcomes, several policy recommendations such as universal health coverage, infrastructure investments, and international funding are crucial. Ultimately, the global health landscape is vast, intricate, and interconnected. Today, I've explored the transformative power of surgical care, its economic viability, and the impact of innovative solutions in its access. Let us not view surgery as a luxury, but as a necessity, a cornerstone of a robust and resilient health system. Together, let's turn the tide and ensure that no one, regardless of where they live, is denied the life-saving surgical care they need. Thank you so much. And feel free to contact me or reach out to me on LinkedIn if you have any questions.